Hello everyone, my name is Noor. I am a foreign medical graduate who has given all of her USMLE step exams, except step 3. I'm ECFMD registered and will be applying for residency in the upcoming match cycle. This current pandemic has given me an ample amount of time, so I've decided that I should utilize this time to give back to the community in whatever capacity I possibly can. I will be talking about a few medical topics here to clear some of the concepts that the medical students struggle with. The topic of our discussion today is hypertension. It is quite a common condition, and majority of you must be aware of what hypertension is. But I'm surprised to see how so many of you cannot differentiate between simple hypertensive terms. So, for example, if you know the difference between hypertension, hypertensive emergency, hypertensive urgency, malignant hypertension, and hypertension encephalopathy, then you can skip the video. However, if you're not sure, then I would recommend that you finish this video till the end. So, what exactly is hypertension? Hypertension is when your blood pressure is more than 130/80. Okay, so there are two types of hypertension. One is primary, the most common type. 90% of the diagnosed patients have primary hypertension. Then there is secondary hypertension, which is the remainder 10%. Okay, so primary hypertension is also known as essential hypertension. And why is that so? Because we cannot pinpoint our fingers on what exactly is the cause of this hypertension. We do know and we are aware of certain risk factors, but we cannot pinpoint the exact thing that leads to hypertension. Okay, so what are the common risk factors that we should know of? Number 1 is your age. Number 2 is if you have any family history, then you're more prone to developing hypertension. If you're obese, there are more chances. If you're physically inactive, then yes. And excessive salt intake, etc. There are other risk factors as well. Secondary hypertension is when you develop hypertension secondary to another medical condition. And the ones that are most commonly associated with secondary hypertension are conditions associated with your renal vascular system. So, if you have a renal vascular disease, you're more prone to developing secondary hypertension. And the one that you're most commonly tested on is fibromuscular dysplasia. I would like to take some minute and talk about it. Fibromuscular dysplasia is a condition which is most commonly seen in young adults, especially women of childbearing age. And what happens in this condition is that there's inappropriate development of your renal vascular system, right? So if you do a scan of your renal artery, what you would see in this condition would be a characteristic strings of beads appearance, which is basically you would see something of this sort. It's like strings on beads. Something of this sort is what you will see on your vascular scan, all right? Then, if there's stenosis of your renal artery, you can develop hypertension, secondary hypertension, and it's most commonly due to an atherosclerotic plaque. All right. And thirdly is normally it's not that common, but it is due to a steroid hormone, which if increases excessively in your body can cause secondary hypertension, and that hormone is aldosterone. and the condition is called hyperaldosteronism, right? So basically, aldosterone is responsible for absorbing salt and water, right? So if there's excessive hormone aldosterone in your body, there are more chances of you developing hypertension. Okay, now moving forward, now that we know the difference between the primary and secondary hypertension, you can very easily answer your questions. If you're given in a question stem a patient who's young and has hypertension, okay, and you're given like 4 or 5 options, you should be looking for the option that has secondary hypertension. Why? Because secondary hypertension most commonly occurs in young adults, usually adults from 20 to 40 years old, whereas primary hypertension is most commonly seen in elderly patients, normally more than 50 years old. So a little information just about the age can really help you answer your questions. So I would recommend reading questions very carefully. Now moving forward, hypertensive urgency. So what exactly is hypertensive urgency? Okay. Hypertensive urgency is when you have severely high blood pressure, and that would be more than or equals to 180 or 120, which is a very, very high blood pressure. If you have this, but you do not have any acute end organ damage, then you are set to have hypertensive urgency, right? Whereas hypertensive emergency is when you have blood pressure which is severely high, 180 over 120, similar to urgency, but along with that you have acute end organ damage. Now, depending on which organ gets affected, you will see symptoms. For example, if your brain is affected, then you will see maybe stroke, maybe cerebral edema, etc. If your, for example, eyes get impacted, then you're likely to see retinal hemorrhages, papilloedema. These are some of the things that are on top of my mind. If your heart is impacted, then you can see myocardial infarction, heart failure. You can even see aortic dissection. Alright, etc. If your kidney is, for example, impacted, then you can have acute kidney injury. Alright. So depending on which end organ gets affected, you will see symptoms accordingly. Okay. Now, this does not end here. Hypertensive emergency can be further categorized into 2 things. Number 1 is malignant hypertension, whereas the other one is hypertensive encephalopathy. Encephalopathy itself gives the thing away. So it would be something regarding brain damage. Alright, so if you have very high blood pressure, let me just put it out there, 180 or 120, in both the cases you'll have high blood pressure. If you have some sort of brain symptoms, for example, some neurological defects, some neurological symptoms, or cerebral edema, you have hypertensive encephalopathy that you're dealing with, right? Whereas if you have similar very high blood pressure, severely high blood pressure, but this time your symptoms are, instead of symptoms related to brain, you have symptoms related to your eyes, retinal hemorrhage, exudates, or papillary edema. You have yourself a malignant hypertension. Okay, so if we are to create a flow chart, we have hypertension 130/80, right? Hypertensive, urgency and emergency, both have more than equals to 180/120, right? And similarly, even malignant hypertension and hyperencephalopathy also have very high blood pressure. All right, so I've tried to break down hypertension for you, and if you think that this video helped you in any way, shape or form, please let me know. Comment in the comment section below to let me know what more topics I should speak about, and how can I improve my videos, and if you have any suggestions, that you could. And if you like the video, please feel free to subscribe my channel, and I will see you guys really soon. Take care. Bye bye.